Today we are going to be talking about prenatal and postpartum physical therapy and why you need to hire Painless Pregnancy now. Hi everyone, and welcome back to the Bang Energy Family channel. Today we have a very special guest today, Dr. Kat Vigo from Painless Pregnancy. Dr. Kat and many of her other amazing therapists have been one of the biggest blessings to our family, and especially in my most recent home birth. Now, if you are new here, my husband and I own the global beverage company Bang Energy, and this is our new channel that we recently started, sharing all of our tips on how to raise healthy and thriving children. And the first step in any attempt to raise healthy kids is making sure mom and dad are feeling their best through pregnancy and beyond. Welcome to our channel, Dr. Kat.
Thank you. Thank you so much for having me.
Thank you for being here. So if you could just tell all of our viewers today about your business.
We run a home health concierge company. We are a team of doctors of physical therapy, and we specialize in the pregnant and postpartum woman.
Love it. So just an incredible group of women, and you heard her right, she comes to your house, which is amazing. Like, it's just full concierge service. She will come to you because I know that all the moms out there are super busy, especially when you're pregnant and you have other little ones.
Yes,
right?
absolutely.
A lot of your patients have a lot of little ones running around,
Yes.
right?
Yep, absolutely.
Yeah, so she will work with you and make sure that, you can flex through your busy schedule, and she will come directly to you, which is like my favorite thing. So tell us a little bit about what you do for moms during the pregnancy phase.
A big part of physical therapy is going into a situation where there's something not working well. So either there's pain in the body, there's dysfunction, like you can't walk well, or for my category of people, you can't keep your pants dry. So
Yes.
essentially the idea is that we study the pathology of the body. And so after doing this for 15 years, I really started to see, specifically for the pregnant body, that there's so many things that we can do conservatively with our hands, with their movement strategies, with their postures, to prevent those problems.
Yeah.
So like, we do still treat the pain and the dysfunction, but we love to go in there preventatively and make sure that
Yes.
doesn't happen.
Yeah, and I started working with you through just my very last pregnancy, so my fifth child. And my birthing photographer actually recommended you to me because I was looking for some sort of something with my body to get myself ready. This last pregnancy, I was dreaming for like one of those births that you see on Instagram, a home birth, water birth, where the mom just like basically delivers a baby themselves, like, look, I just did this. Because, it was my fifth time, so I was like, I can do this. So I was really just looking for as much education and like work I could do to myself to make me feel like super confident through that time. And it's really crazy because I never even thought about it before, because I really have been blessed with like pretty good pregnancies. Like, I'm not like the person that's like always in pain, because there are a lot of women that are just like miserable. And so a lot of women just think like it has to be that way, but it doesn't have to be that way at all. And I know that you have helped so many women just like feel normal,
Yes,
right?
absolutely. Yep. Feel like themselves again.
There's, little things that you will feel when you're pregnant. And unfortunately, when you go to like, a regular doctor or whoever, maybe your obstetrician or whoever it is, they're probably just gonna tell you, well, that's normal, and then like carry on. But there's actually a way to fix and to help those symptoms. And Kat really has helped me through some of those minor things that I was going through during my pregnancy, and then I started to like feel better, and I didn't even realize like, wow, there is definitely a better way. Like, you don't have to feel, even the minor things that I was feeling like were going away, and I just felt amazing. Like, I would always tell you, like, when she was about to leave, I'm actually like, don't leave me, because every time you're here, I feel amazing, and I just felt like a breath of like fresh air. Like, I was like, wow, I feel like amazing, because it is challenging to be pregnant. You're holding a lot of weight. I started working with you like the very tail end of my fifth pregnancy, so I was, had my big belly, so I just felt amazing, and I really wanted to share you with all of our followers and all of our friends, and I have been recommending Dr. Kat to all of my pregnant friends because you just really feel amazing. I never even knew this service existed.
Yep.
Yeah. So what are the like common things that you see with most of your patients that are like pretty common with like most pregnancies that you're able to fix?
One of the most common complaints that we get is the pubic symphysis pain. So like pain at the lowest point of your pelvic bone. Sometimes it can go down to your inner thighs, it can wrap around, so you can be telling us about sciatica or low back pain, but it's largely this area here.
Yeah. The great thing about Dr. Kat and all of her therapists, they're all amazing. Like I love when something is bothering me and I can actually ask someone like, why is this happening? Because once you can understand the way the body is working during pregnancy, like Dr. Kat will tell you, well, this bone, I can't tell you, but basically something more along the lines of this bone is moving to make room for your baby, and this is why you're feeling this way, and this is what we're gonna do so that you feel some relief, and then you understand it. And that's what I love. I love being able to understand my body, knowing what is actually going on, and that it's what my body is supposed to be doing, but then what you're actually doing to kind of like solve that and get me to the place where I'm feeling more comfortable.
Sure, absolutely. And I can speak to that also a little deeper, because what we found when we follow these women through a pregnancy, it's sort of a perfect storm, right? So your first trimester, how do you feel typically?
Tired.
Yeah, like garbage. Like you're trying to stay awake, you're trying to eat food that won't be coming back up.
Yes.
Really you're just trying to survive. So that time is not typically a season for us to be exercising, moving well. So we're just trying to conserve energy. And that's fine and normal. It's exhausting that first trimester.
Yeah.
But it's possible that we atrophy, right?
What does that mean?
So it means that we might have been exercising up and through that point, and God bless if you can continue to exercise during your first trimester, amazing, and do it. But most of us, at least for a few weeks, take time off. Like we might lay down more than we ever lay down. So our muscles get thinner and smaller.
I see. Yes, exactly. Yeah, in my first like 5 months, I'm throwing up every day. So it's really hard to get into the gym, but like I try as hard as I can, because I know that, the better I can stay in shape throughout my whole pregnancy, the better will be for labor, that's why they call it labor, because it is labor intensive. It is work. It's not impossible, but it's work.
Yes, it is. It's such a marathon.
Yeah.
And so you get through that first trimester, and then in your second, you might get this wave of like, oh, I have life again. I can, I can keep food in. I have some energy. And you might not notice that not only are your muscles thinner and weaker, but your body is already spreading and gaining weight.
Yes.
So now you have, on a less sturdy frame, more weight and more width.
Yes.
So then you start to exercise and move, and you're going to encounter some dysfunction. So that's why we usually see it in that second trimester.
So tell me, I know you shared with me at one point some of the statistics around how many women are like feeling pain through their pregnancy, and maybe then you could talk about like why you decided to take your practice to like more of an at-home concierge service, as opposed to like being in a hospital setting.
Yes, so it's kind of astonishing when you look at the studies. They range anywhere from 60% to 80% of pregnant women will report some kind of orthopedic pain. Back pain, neck pain, hip pain, some kind of dysfunction. And then some studies show that of that, say 80%, 50% of them are saying that this is impeding their ability to do life. To work, to take care of their kids, to get in and out of bed, basic things. And so one study that we came across recently showed that up to 90% of women in a low back pain category also had pelvic floor dysfunction. And so that's something that we specialize in as well. So we have that like 4 or 5D version of that pelvis, and knowing how the pelvic floor can impact the whole function of your spine.
And I hate that, because I'm very big on be fruitful and multiply. I want to have as many kids as God wants me to have. And I feel so sad when I talk to women who say like, I would love more, but I had a terrible pregnancy experience, and that just breaks my heart, because I know there's support that you can have through this process, like going to Painless Pregnancy, because it would just make that experience so much more manageable, at least.
Absolutely.
Because there's just so many things that women experience, and really a lot of women don't even know that there is support at all. Again, saying, the thing we said before about the doctor will just say it's normal, and then you feel like you just kind of have to deal with it, So that's incredible, those statistics. It's crazy. So what made you decide to like take your practice like out of the hospital setting?
So I tried really hard to make it work. It was an outpatient clinic connected to the hospital. loved my coworkers, loved my boss. The environment was beautiful. And then I tried to make it fit for pregnant and postpartum women. And, you know, one, we took insurance on the front end. So, that appointment got canceled because there was no pre-auth, all this red tape, right?
Yes.
So that frustrated me.
Yeah.
And then I noticed that, you know, with the wait lists, and then it was hard for moms to get to the clinic on time consistently. You know, she might get there 15, 20 minutes late, and by the time I bring her back, I might have 15, 20 minutes to be with her because I have 2 other patients waiting on me.
Yeah.
So just the way it was set up, it was not convenient. And, you know, we will like walk through fire to get that newborn to their day 2 visit and month 2 visit and like all these. But when it comes to us, we'd be like, oh, I'm just too tired.
Yeah, it's not going to happen.
I'll cancel that appointment because it's for me and I'll just cry about it. So I started to see women in the evenings and on the weekends while still working at the hospital.
Awesome.
And they just loved it. They
Yeah.
loved the home care. And you know what else, Meg? I loved it.
Yeah.
Like I loved going into their home and kind of seeing the environment.
yeah.
And you would know like, okay, that dad is on top of it and he's gonna support her through it. Or like, okay, I have to let dad know that he needs to bring her water when she's nursing and like make sure the toddler's over there while we're doing therapy. You know, you kind of understand the family dynamic and what her true support system is like.
Yep.
And how you can lift that up.
Oh, that's amazing. Yeah, I know. And after one of our appointments, we went to the nursery and you looked at how I was breastfeeding, because some of the things that I started to experience was like neck pain when I was breastfeeding after the baby already came. And so that was really great for you to see like, okay, how are you sitting? What does your nursing rocking chair look like? How are you, you know, all those little details make a big difference because it's something you're doing every 3 hours.
Yes,
So
absolutely.
if you have a better posture that you can practice, you know, it's going to be helpful for you. And that's so great. Like just knowing, you know, you have became part of the family, like absolutely. And so it's so wonderful that you can come in the house, see how everything is going and just the support system, like you said. But it's great. It's just like you said, us as moms, we don't take care of ourselves like we should. But this is the reason why we wanted to share this, is because really being able to be there for your kids, you have to be physically healthy, mentally healthy, everything like that. You have to help yourself first before you can help your kids, and so it's really, really important. And it just makes it so much easier when you can come to us. So that's amazing. One of my favorite times with you and some of your other amazing therapists is just that delivery prep season, and it was just so exciting for me to learn more about how the body works. So like tell us about that in your own words, because I can't explain it, but like tell us what you do for these amazing moms that you work with for that delivery prep season.
We are all about the muscles and bones, and so we hyper focus on that pregnant body. So we understand in detail how the baby needs to go from uterus into the pelvis and then out of the pelvis. So there's some really simple mobilizations that we do. Well, we do start at the rib cage because that's your pressure management space, and that's the baby can be up towards the rib cage. So we make sure that space moves.
Wow.
Because that's your first line of defense.
Yes.
So even if you do have plans to have an epidural, you don't know if that epidural is coming as soon as you walk into the facility or in 3 hours when you're screaming for it. You might still need to wait. So you want to know that you have your breath capacity to help you.
Wow.
And then we release the abdominal fascia because that allows the uterus to move how it needs to. Because truly the delivery process in its natural state is a dance between mom's body and the baby's body.
Yeah.
So baby does not only like twisting and rotating, but it also travels.
So
right?
cool.
And so the last part of that is the pelvic space.
Okay.
So we work the bones to make sure that they move fully, especially that sacrum with the tailbone. We want to make sure that moves, which through our eyes is simple. It's mobilizations of the bones. That's what we do. And then the final component, sometimes our moms will either choose to do this or decline it, but we do the internal pelvic floor work. So we can help release that perineal space that often gets torn with deliveries. And then we can go deeper and release all the deep pelvic floor muscles.
Amazing.
The other component, so you can release that space and make sure it's pliable and stretching, right, for that baby to come down. The other thing we can do is in real time with a single glove finger, give her feedback when she practices her pushing strategies.
Oh, that is so huge. That is so huge, like incredible. So yeah, that is just so amazing. And like for me, like listening to that, I get like so excited because the human body is amazing. Like especially the female body, because we birth humans. Like hello, that is so amazing. And the way it works is just so perfectly designed by God. And like knowledge is power, but also like knowing that you were built to birth gives you so much confidence that you can do this, because a lot of women just, they don't want to hear about it. they just want to figure it out when they get there.
Yes.
And maybe that's for you. Maybe that's the way you need to go into it, and that's fine. But I found for me, like, that knowledge was so much power and confidence going into it, where I'm like, I know what my body is doing. Because when you feel certain things, you're like, yes, I remember Dr. Kat telling me about this, you know? And then you're like, it's normal. Instead of like you walking into it and it's just like this like train wreck and you're like, what is happening? Yeah. I'm feeling all these different things. So I absolutely love that. And I purposely was trying to find that confidence for my birth. And it's crazy because I imagine it to be, like we were saying before, like this perfect, you know, I'm birthing my own baby. Like it's, you know, just the easiest one that I've had, similar to the last ones. But yeah, I just love having that confidence going into that kind of unknown situation, because I never expected that I was gonna have to, you know, have that challenge of having a breech birth at home. Like I, you know, at this point I'm up for anything. Like give me twins. Like I God, give me anything you want. But I'm so happy that I had that confidence because I got through it, and now I can look back and be like, wow, I did that, you know. And part of a lot of what you guys have taught me really was the reason why I had that confidence. And so I thank you guys so much for that, because little things count, you know, through that, you know, I love the fact that like all of my kids and all my family were praying for me. That was a huge thing that I could like feel, like I could actually feel it. And then just having that confidence and reminding myself, like, no, I prepared for this. Like I was learning everything I possibly could learn. I was asking the right questions when you guys were coming to see me. Like, I know I can do this. So I really think that really helped me get through it. And something you said earlier when you were kind of giving women kind of like feedback on the pushing, which is so huge. It's definitely, you know, something you have to, I didn't do this service with you guys. You know, I was already at my 5th. So I think for new moms, you might want to consider that, because with my first birth with Chantal, I remember when, you know, your first birth is usually like longer than the rest of yours, because your body's like just still trying to figure out what's going on and how to do this, right? So I remember when it was time for me to start pushing, I truly thought that I was pushing. But it wasn't until my midwife was like, no, you have to push here, and she, you know, she put her fingers there, I guess, and I was like, oh, there, I didn't even like realize that. And I thought to myself, like, what if I would have had an epidural and I wouldn't have been able to feel that? So I think, like, you know, you want to have like a birth plan that you want to try to not to get the epidural, because it's just, I personally feel like it's just better overall. But if you do have it in your plan that you are going to get the epidural, like, might as well practice before, because if it comes down to it where you're not pushing in the right way, because it seems very simple, but like for me, I was like, I thought it was, but then once she, you know, told me where I need to push, then I was like, oh, okay, I get it. And then it was like easy from there. But I think that's really important to like practice that, because I never thought that would happen to me in the first birth.
Yeah, it's fascinating too, because just as someone giving that treatment, you would think like you said, it would come naturally. And there's often times where like, okay, let's take a deep breath and practice like as if you're pushing my finger out. And then it lifts. And I'm like, oh, that was opposite. And how many times, like spending time with OBs and in the birth world, I know I'll hear OBs or midwives or doulas say, and that baby was just rocking on her pelvis for like 3 or 4 reps. Oh, wow. And it's like, because you're not managing the pressure from the top and pushing down.
Unbelievable.
So yeah, it really, I mean, it's a tricky thing to measure, but I would love to see if it shifts, you know, pushing time and labor times, and then the trauma you have to experience from the suctioning or the forceps or any kind of instrumental intervention. And just because she's so connected to her body, that process can be more natural.
Wow, unbelievable. Now let's talk really fast about postpartum, because that was something that was like I couldn't even believe it moment, because I'm like, wow, like you know you're recovering. You're feeling kind of, you know, tired, your body kind of hurts everywhere. You feel like you ran a marathon or something like that. But I couldn't even believe how good I felt after I would get treatments by you and your other therapists. Like, it was just like, wow, like that's what you need to actually recover. So what are the things that you do, like when your body is trying to go back to shape?
So it's very similar, that we so focus on the postpartum body that we know how the ribs and the pelvis tend to stay in a pregnancy pattern.
Wow.
So the ribs widen, the pelvic bones widen. During delivery, the sit bones come apart, the tailbone comes way out, and the pelvic floor that attaches there stretches 10 times its normal length.
Unbelievable.
So those muscles are so overstretched, and then the bones are open. And what are the forces that would bring it back together?
Yeah.
Muscle tone and position. And so we do not have any current process in place for these postpartum moms to be helped to close that birthing pattern.
Wow.
So we come in and we help the ribs to relax, which helps the diaphragm to relax, so the diaphragm's not pushing down on the pelvic floor. And then we can ask the organs to kind of settle back to where they should be.
Wow.
They get swoosh up under that diaphragm.
That's crazy.
Right?
Yeah.
And then we ask the pelvic bones to calm down back into a supportive structure. So instead of being a slide so a baby can come out, it becomes that sling to hold the organs in.
Wow. Unbelievable. I mean, I could never explain that, but when I'm going through the therapy, like, it just feels right. It's like, yes, that is what my body wants to do, but it's, you're just giving it the help that it needs to, like, almost recover faster, you know? Because your body's going back to its former state, which is important because you can have some issues down the road, right? If you don't kind of recoup your body to where it should be.
Absolutely. When we intervene soon, we see that the complaints of, I lose urine when I sneeze, or I pass gas when I don't want to. Other categories of like sex is painful, or just like the symptoms of prolapse. So where an organ that should be inside your body, like your uterus, is pressing into the vaginal wall, and it's just kind of coming down into that cavity.
Wow, that's so incredible. And like I said, you became part of the family because you have not only helped me, I mean, my baby is 14 months and I'm still working with you weekly because you have just completely helped my whole body stay together. I'm still dealing with my neck problems that you have drastically helped me with because I was going through a lot through like breastfeeding and everything. After I had my breast explant surgery, the pain has gotten a lot better, and you've really helped me work through all that, understand what's going on, giving me exercises to do weekly, which is really important. She even texts me to remind me to do my exercises because moms are busy, working moms especially, and she's a working mom too, but she still makes the time to remind me. And so it's just all amazing stuff. But not even just me, you have helped my entire family. She's helped my kids. My oldest, Chantal, has had some growing pains and stuff going on, and she loves working with you, and my son as well because he's an athlete, and also Jack. So if you happen to be a Bang Energy family dad, go check out Jack Owak on YouTube. I know it sounds crazy, but Painless Pregnancy does work with men, and he's gonna be sharing a little bit about his fitness health journey on his page, so go check out that video. And Kat, if any of these beautiful women, future moms, want to work with you, tell us a little bit about how they can get in touch with you.
So we do serve moms in the comfort of their own homes, from South Miami up through West Palm Beach. So if you're interested, you can give us a call. You can find us on our website at painless-pregnancy.com. And then we are on Instagram at Painless Pregnancy and Facebook as well.
Thank you so much again for joining us, and I can't wait to continue to work with you, hopefully through another pregnancy. Let's see, God willing. And we just love you so much, and thank you for everything that you do for this Bang Energy family.
Thank you.
Thank you.
Slowly relax it down and then bring it. Yeah, that's perfect. Yeah, I love it. Yeah.